Hi, I'm Jodi Daly, and on today's show, we are going to be talking about allergies. Now, these little buggers affect roughly 50 million Americans and are considered one of the major causes of illness in the country, with close to $6 billion being spent annually on non-prescription cold, cough, and allergy medicine. It's nothing to sneeze at, and I know I'm trying to be funny. It is not a funny subject, but we are going to be talking about allergies today. And with me to talk is allergist Dr. Harshna Mehta. Thank you so much for being here. Allergy sufferer Matt Petroselli.
Hello.
Kathleen McGraw, who has food allergies, and David Cortez down at the end.
How are you?
I want to talk about your allergies first and foremost. Matt, you are suffering from airborne allergies probably as we speak.
Absolutely. Every spring, seasonal allergies. I get the itchy eyes, runny nose, turns into a head cold. It's pretty difficult to deal with every year.
Does it ever get worse than just itchy eyes?
It does. If my suffering goes on long enough and my congestion persists, it'll turn into a sinus infection.
Oh, that's not good.
It's not good.
What month?
March. It's actually right around my wedding anniversary, so it's the least romantic of any season of the year for me, yeah.
Oh, that's a shame. Is it just spring?
It is just spring.
Is it? Good,
Yeah.
because I was under the impression that these things only happened in spring, but I think we're probably going to hear from you, doctor, it's not just spring for airborne allergies.
No, not just spring. Every season of the whole year. So spring is the trees, summer is grass, fall is ragweed and weeds, and then molds are pretty much throughout the year, and dust mites are throughout the year and even in the winter.
Especially if you live in Manhattan where dust is just more prevalent than, I don't know about you guys in the rest of the country. Now, Kathleen, you have food allergies, but not only do you have them, your kids have them. Tell us about that.
Yes, so I'm allergic to tree nuts. I started this allergy when I was in middle school. I was the only kid I knew growing up with food allergies. And now I have 3 children, 2 of whom have food allergies. My son is allergic to tree nuts and shellfish, and my daughter's allergic to tree nuts as well.
Now, doctor, what is the difference between tree nut and peanut allergies?
So peanut is a legume, and tree nuts are nuts. So they just are different in terms of protein structure. So
And
legumes are like peas, chickpeas, beans.
So does that mean if you're allergic to peanuts, you're also allergic to peas?
Not necessarily so, sometimes, but not always.
So the kids can't get away with saying, I don't want to eat my peas.
They cannot.
Okay. Now, David, down at the end there, you look like you have allergies. You're pretty much allergic to everything.
What he has, what she has,
But you,
and more.
But some of your list would be what?
Well, food allergies and seasonal allergies as well.
What kind of food allergies?
Nuts, garlic,
Garlic.
spinach, fruits with skins, apples, cherries.
I have never in my life heard anybody allergic to apples and cherries. Dr. Mehta, you've heard what they've all said.
Yes.
What are some of your comments to them
Yes.
about their allergies?
So the most common 7 food allergies are milk, eggs, most commonly in children, wheat, soy, peanut, tree nuts, fish, and shellfish, right?
Now, you were saying in both children and adults, is it more prevalent in one or the other?
So children tend to have the milk and the egg. 80% of them outgrow it at a certain point. So adults not as much, but they still can hold on to it. Peanuts, tree nuts, shellfish kind of stay around for a while. The apple and pear and nectarine and cherries that you mentioned are more likely related to something called pollen food syndrome, which is due to your seasonal allergy.
What is pollen food syndrome?
That's a good question. So it's
I
because
know I asked the good question.
the
Anyway.
apples, cherries, pears, nectarines, they all come from trees.
Right.
So it's something where you bite into it and your body thinks you're biting into a tree, not necessarily a food. You can probably have apple pie and apple juice
Which I
and
do.
cherry pie because the protein now has been cooked. So now your body recognizes it as a food and not necessarily as a tree.
Huh.
Which is true, because I do indulge in apple pie.
So basically you're saying that these certain foods, if they're cooked or transformed somehow, the proteins go away?
The proteins change.
Proteins change.
Yeah.
Okay. What are some of the reactions that you guys have when you have eaten certain things? Or now you say that it probably the nose runs and you get.
Right.
What are your reactions?
I just feel like I have a head cold for about a month.
And a
every
sinus
spring.
infection, you
Correct.
said. That's really bad. So things can
Yeah.
turn from one to another.
Absolutely. So usually with environmental allergies, you tend to have runny nose, itchy eyes, nasal congestion, and that mucus sits there, and it's a cesspool for more bacteria. So you end up getting a sinus infection.
Oh, that sounds lovely.
So yes, allergy patients end up having more sinus infections than the average non-allergic patient.
And what about food allergies?
So food allergies, I'm sure they can tell you, are various different reactions.
What would be some of your reactions, Kathleen, or your kids?
Right. So with me, my worst reaction was my face swelled up. Now, as soon as I have a bite of something with tree nuts, I just feel an itchy tongue, and if I stop, then I'm good. My daughter tends to vomit, and my son tends to break out in hives from head to toe.
I'm not bringing walnuts over to your house, I promise. And David, how about you? Well, you're allergic to everything, so.
Closing of the throat.
What are some of the things that you would tell him, make sure he has with him?
All the time.
Yes.
So he should have an epinephrine auto-injectable, right? So that's in case of an anaphylactic reaction.
And that's if your throat closes up?
Well, yes, but the definition has now changed. If it involves two systems, so for instance, if you're vomiting and being covered in hives, you should use your epinephrine. If your throat is closing up, you're turning blue, you're repetitively coughing, your airway's compromised, then absolutely you should be using your epinephrine.
Do you carry a breathable as well?
Because I get asthma as well, yes.
Wow.
Right.
So what I'm hearing now is that allergies actually tend to jump into more serious things.
Yes, absolutely.
And is there a difference between children and adults? I mean, there's a school of thought that says if you introduce certain things to children's diets in the beginning, maybe they won't have those allergies. What's your thought on that?
Yeah, so newer studies are showing that early introduction is probably better. So absolutely. So now, before the pendulum had been, we introduce at 2 years and after for allergenic foods. Now, early introduction better, because the thought is the early exposure may prevent them from having allergies.
Did you do that?
Well,
to your kids?
The age my children are, at that time, the recommendation was hold off until 2, especially because my son had the allergies with the younger children. They said, for sure, hold off till 2, so I did that.
Now, what about airborne? It's not like you can't breathe.
Yeah, so airborne's difficult. I mean, right, so if you're allergic to all seasons, the pollen gets into your nose and gets into your eyes. So that's almost, you have to treat with medical treatments, meaning either medications or immunotherapy.
You know, I developed an allergy later in life, and now I'm allergic to my mom's cat.
Right.
So how does that happen?
So we don't exactly know. There's multiple studies out. A few of them suggest it's the hygiene hypothesis, where we've sanitized our hands so often that we've changed our immune system to a more allergenic immune system. We've had a lot of antibiotics in the 80s, and it's caused a lot of resistance. There's the vitamin D story, where perhaps the deficiency is causing the allergies. So there's nothing out right now that puts it all together, but there are studies that point in those directions. So it's most likely a combination of all of them.
Well, I make her vacuum before I come in, so that's about all she can do. Anyway, when we come back, we're going to take a quick look at how we can maybe treat and avoid some of these allergies and their symptoms, and we're going to press you for a little inside info.
Absolutely.
We'll see you in a minute.
Squirrels know how to save. They have to. But people, they're a different story. Some try coupons or check apps for the lowest price. Some wait for the word SALE. Many people, however, know that the lowest prices without coupons or special sales come when they regularly buy store brands. Food, beverages, household, health and beauty. Your supermarket, drug chain or mass merchandiser has store brands with comparable ingredients, taste and performance to more expensive national brands. A family of 4 can save $1,500 a year. And you can squirrel that away for other things you need to buy. Store brands, the real way to save.
And we are back talking about allergies and what we can do to lessen the effects and avoid them if that's even possible. And David, Kathy, Matt, and Dr. Mehta, thanks again for being here. I just want to say one thing. David, I'd like you to show us what you have to bring with you at all times. That is your bag?
This is my allergy bag.
So you can't go anywhere without that?
No. No. I mean, no.
Has it gotten worse as you've gotten older?
Yes.
Absolutely. And that's one thing that I don't remember allergies being as big a conversation 20 years ago as they are now. Why is that?
There is definitely an increase in prevalence. So 1 in 13 children in the United States have a food allergy.
1 in 13?
1 in 13.
Wow.
So we're not sure if it's just that we're diagnosing early or if the prevalence is actually increasing. Probably a combination of both, but certainly seems like it.
When you're saying we're diagnosing earlier, do you find as parents that you are looking for things earlier? Kathleen, were you looking for things because you actually had allergies?
I think I was, yes. And although I didn't give my son nuts when he was young, but his first reaction was actually to dairy, to yogurt.
And what was his
his face swelled up.
Oh,
Yes.
that must have been scary.
That involved an ambulance visit.
Obviously, it's a hereditary in her case.
Possibly. I don't know that for sure.
Well,
but
no,
the
and we're
fact
not
that-
asking you to
No, no, no,
diagnose
but
her
the- but-
swollen child
Right,
on
but the
television.
fact that mom had allergies puts you at a higher risk. So if a maternal figure has either asthma, food allergies, or eczema, you're at a little bit of a higher risk.
What do you see, Kathy, that you will avoid to make sure that, obviously nuts, but do you have to read labels more? Do you have to make sure that certain things, even nut oils, aren't involved in foods?
I do. We do read food labels. Like I said, we don't have to worry about if it's processed on machinery that also processes nuts, as long as we don't eat the nuts ourselves. But I do read food labels. We have to ask questions when we're in restaurants, especially Asian restaurants, about how foods are prepared and what sort of oils are used. So there is some due diligence that we have to perform.
And Matt, what about you?
There's really no escape for me from
But
you know,
there's those
airborne
little white,
allergies.
those little things you can wear over your,
Right, and
which
right.
is really attractive.
Yeah, I don't know if it's worth the social reaction doing that, walking around with a mask. But really, all I can do is try to medicate with over-the-counter medicine. I've tried prescription medicines and even diet change.
Oh, good. Okay. And David, let me see the bag again. What would help him not to have that bag?
There are certainly therapies that for everyone could be done. So for food right now, there's really no therapy except avoidance. So doing exactly what you're doing, which is your due diligence, reading labels, and avoidance. In terms of airborne allergies, definitely topical related medications, either to the nose, so nasal sprays, or eye drops would be beneficial. For you, it would probably be, well, or a combination. So probably topical therapies in terms of for your skin. There are definitely biologics, which are new, that are coming out. That would be beneficial, in addition to perhaps doing allergy shots.
I've done all the traditional
Yes.
shots and everything, and there's a slight improvement, but not really.
Would a diet change help David?
Sure. I mean, avoidance of the things he's allergic to will certainly decrease his allergenic reaction.
But what about, you were talking about
pollen food syndrome.
pollen food syndrome. Did you know about that?
I did not.
See? Learn
Did
something
not-
every day here.
I grew up in South America, and didn't have any of these allergies. These allergies only arose when I moved to New York. So I don't know if it's environmental or food or
David, I
or
think we
age.
have your answer. It's a very long plane ride.
No, and it's true. I go back and I'm fine.
And you're fine.
Yeah.
Oh, that's a shame. Well, let me ask you this. Where is research going?
Oh, it's going. In terms of foods, there are patches that the FDA will hopefully be looking at and considering approving, where it's a peanut patch that you wear and it exposes you to peanut and hopefully desensitizes you over time. There's also oral immunotherapy, where same kind of concept. You expose the person to these foods and desensitize them and hope they're no longer allergic. All these things are still in research. We're still waiting for approval. But those are on the horizon. In terms of airborne allergies, definitely there's new biologics that are coming out that would help in addition to just immunotherapy, where you do allergy shots.
And you said diet helped you, changing your diet.
It did, changing my diet. I had seen, I'd suffered for allergies for so long. I'd seen different doctors and actually went to a nutritionist who recommended some changes. And that did bring relief, but any change in your diet comes with a lot of effort and a lot of habitual changes, so it was difficult, but it did bring me a little bit of relief.
I love a guy saying that. Oh, you have to change your diet. Do you know how many times we have to change our diets just because summer's coming? Seriously. But yours is much more serious. Anyway, I really want to thank everybody for being here. David, I'm so sorry you have to carry that bag with you, and I'm so sorry that you would have to move back to Brazil, but I have a feeling that on the horizon there may be an answer. Kathleen, sounds like you've got a really great handle on what's going on with your family and your kids, and they're really lucky to have had a mom who had to go through this. And Matt, thanks again so much for, I'm sorry there's nothing we can do about the air at this point. And Doctor, I feel like that we've all gotten such a tremendous amount of information. I'm so glad you were here with us today.
Absolutely.
We really appreciate it. And I thank you all out there for being with us. And I just have to say one thing. If you have allergies, go see a doctor. You don't want to end up with a sinus infection or a closed up throat or dragging around a bag of stuff like David has to. And for more information on what you've seen on today's show, please visit Store Brands USA channel on YouTube or go to storebrandsusa.com for shopping information, recipe ideas, and a whole lot more. Thank you all again for being here, and thank you, and I'll see you next time on another edition of Let's Talk. I'm so sorry you have to carry that bag around with you.